Good evening, everybody. Thanks for joining us on this webinar with the University of Nicosia. We're going to be talking tonight about applying to medical and veterinary courses, predominantly in 2025, but there might be one or two of you interested in this year or indeed later dates. That's absolutely fine. But the focus of today is really assuming that you are coming to the end of year 12 in the UK system. That means you've got another year to go before you do your A-levels. And during that year, you'll be applying for medical and veterinary schools, probably in the UK, but also and possibly also abroad. We want to today just make sure that you know what you're letting yourself in for so that you can do things properly. Now, before I get started on the presentation, I do just want to introduce Melanthia Augusti, who's from the Admissions Office of University of Nicosia,
Hello, everyone.
and Dr. Soulla Nicolaou, who is from the Faculty of Medicine, and she will be the one giving the presentation, and Melanthia will be the one answering all your questions about how on earth do I get in. So
Good afternoon, everyone.
okay, now I am just going to, as usual, make you wait a second while I share my screen. Here it is. And I'm now going to start running through what I hope is a quick presentation about the things that you need to worry about. Now, obviously, some of you will be hearing about us for the first time today. So I just thought I'd introduce who we are. We provide students with information about English taught higher education in Europe and further afield. We've been doing this now for nearly 20 years. And over that time, we've helped thousands of students go abroad to study all sorts of different subjects, predominantly in Europe. And it's fair to say that over recent years, there's been a real concentration in medicine, dentistry, and veterinary medicine. So roughly 75% of the time the phone rings in our office, I know it's somebody who wants these particular subjects. Now, why is that the case? Well, there are many ways you can look at this, but these are some recent stats I've just pulled off a website earlier today that give you an illustration of the problem. You're going to know that it's really quite tough to get in the UK. The numbers are not in your favor. If you look at some of these medical schools here, you can see that roughly 15 to 20% of people who apply in some cases will get offers from each medical school. So it's quite common to end up without any offers at all. You can also see from the average UCAT scores that I've put there that it's quite difficult to, get in if you don't have a very, very good UCAT score. So for medicine, it's tough, okay? It can also be tough abroad. We'll cover that, don't worry. But it's probably going to give you a few more options, let's put it that way. Medicine in Europe is actually taught, to the best of our knowledge, at 85 different medical schools. So this in English, okay? So these are the options that you have. 18 of them in Italy, that's including about 4 private and about 14 public ones, 15 in Poland, 8 in Romania and the Czech Republic, and 6 in Bulgaria. So that's where the majority of courses are, but you will find isolated examples in Germany, Latvia, you name it, a whole range of different countries as well. But in terms of Western or Mediterranean Europe, the options are basically Italy, Malta, and Cyprus. And obviously, you're going to hear a whole lot more about Cyprus in a moment. I don't want to get stuck into money. Sorry, I've gone too fast there. I don't want to get stuck into money too much during this presentation, but I did decide to put a slide in here just for reference, really, so you can get a rough idea, a rough overview of what the tuition fees are. Now, the cheapest options in Europe are the public universities in Italy, but these do have, related difficulties in terms of the application process. You're going to find it very, very difficult to get in there, but if you do get in, you could, save a lot of money. Romania and Bulgaria tend to be the cheaper options, but then if you start looking at places like Czech Republic and Poland and the private universities in Italy, then you are looking at sort of 20,000 euros a year. Similarly in Cyprus, where I put an average figure of 21,000, but we can talk more about the money involved in Cyprus a little bit later on. Now, in general terms, I do have to say that the biggest issue is not necessarily how much it costs, but the fact that you are going to have to pay for it from your own resources. So none of this is covered by student loans from the UK. You're having to pay for it yourself. So that is just a fact of life. Scholarships are actually very, very rare in this area. They do exist in 1 or 2 cases, but that is literally it. Now, for those of you interested in veterinary medicine, you have options as well. There's a slight growth, I would say, in the number of veterinary options in continental Europe. But right now, most countries only have 1, occasionally 2 options. Poland is special in the sense that it has fall. So those are the places where the veterinary courses are. And again, there are very, very few, if any, that are taught fully in English in, if you like, Western Europe. So really, it would be places like Cyprus that you'd be focused on, or Central and Eastern Europe. Most degrees in veterinary medicine in Europe are 5.5 to 6 years, although the UNIC degree is actually 5 years long and, more or less comparable to what you'd be finding in the UK. Tuition fees, well, I haven't put them up for every single country there, but they're basically in a range between 6 and 20,000 euros. So that gives you a little bit of an overview as where the options are and, a little bit of information about how much it's going to cost. But really what I want to focus on today is the journey that you're just about to embark on. How do you go about choosing a medical school abroad? What kind, or a veterinary school? It's the same thing for both of these, for anything really. I would say that the most important things to consider are, number one, is this a right opportunity for you? Have you really thought about living in another country for 6 to 7 years? This is a big decision to make. So, if you don't feel comfortable with it, you really should be thinking twice about whether or not you want to go. Are you prepared to learn another language? Specifically for medicine, you're going to be dealing with patients. You can't become a doctor without learning how to deal with patients. To what extent are you going to need to know a new language? Some countries will insist you learn it to quite a high level before you're allowed to go into clinics. Others, it might just be a minimal amount so that you can basically reassure patients. But I would say one of the biggest questions that I recommend you ask that, often doesn't come up at all is, how many students are admitted into the first year and how many graduate on time? The dropout rate. Now, in a lot of European universities, the dropout rate is much higher than you'll be used to in a British context. That is not necessarily a bad thing. I don't think there's any universities out there who are consciously trying to fail students who are good enough. That's just simply not what's happening here. But it is certainly the case that in some countries, your chances of reaching, your goal within those 6 years will be better than in others. Say, for example, in somewhere like Hungary, the number of people who might graduate on time can be down to as low as sort of 20%, something like that. Whereas in other countries, it will be an awful lot higher than that. So, there's one thing is getting in, there's another thing getting out on time. Because I fully understand that when you're looking at medical veterinary schools abroad, it's not because you've suddenly developed a desire to live in another country, although I hope you do develop that. It's much more about the fact that you will be, focused on becoming a doctor or a vet at the end of your journey. Now, talking about how you get in, this is obviously the biggest obstacle you face immediately: entry requirements. So what do you need to get in? Well, again, I'm going to generalize here because every medical, dental, or veterinary school is a little bit different. But as long as you are taking A levels in biology and chemistry, you are almost certainly going to meet any prerequisites. So as long as you'll need 3 A levels, but as long as they're biology, chemistry, and something else, you will be fine for most universities. For some medical schools, if you have biology, but you don't have chemistry, but you do have maths or physics, that might be okay. For some veterinary schools, usually it's actually chemistry that's demanded more than biology. But generally speaking, as long as you've got biology and chemistry, you should be okay. For the universities that we work with, I would say that if you're predicted 2 A's and a B and above, yeah, you've got no problem. We can easily help you. Below that, your options will decrease, but you will still have options, okay? However, very, very few universities in Europe will assess you based entirely on your A-level performance. It is very likely that you will have to do an entrance exam. Now, these entrance exams in other countries are not like the UCAT that you will be used to, as in, one test that's valid for now valid for every single medical school. Most medical schools in Europe and most veterinary schools will have their own exam. Okay, so you will have to take that. You'll have to take the exam that they set. Sometimes you'll have to go to the university to take it as well. Not always can you do it online. And for each and every one of them, you are going to have to prepare. Now, the first thing, well, I've said several things already, but the next thing I want to say about entrance exams is that you should never, ever prioritize these over and above your A levels, okay? Make sure your focus remains on your school studies rather than entrance exams. So when you're coming up with a strategy that involves applying to medical or veterinary schools abroad, If there is an entrance exam, make sure you know when it's happening and you give yourself enough time to prepare for it. Don't just spring it on yourself at the last minute. So again, this is one of the reasons why I'm inviting or encouraging you to do your research into your options now, even though you're not looking to apply until, well, you're not looking to go until September, October 2025. So most entrance exams actually are quite similar. They'll have their own curricula maybe, but many of them will focus on, well, they'll all focus on biology and chemistry. And then it's quite normal for there to be an element of logic, verbal and mathematical reasoning, sometimes even some maths and physics questions. One or two universities that we work with even have religious questions if they happen to be Catholic universities, for example, but the vast majority will be biology and chemistry. So even though you might be able to apply without, say, chemistry A level, you're probably still going to be examined on your performance in chemistry in the test. So you do need to have a basic scientific knowledge, at least, with these tests. I would always encourage you to, well, I never used to encourage you to take preparation tests that might exist for this, but I do definitely encourage you to do that these days, simply because we have seen that they work. So, preparing for an entrance test will improve your chances of passing it. Sometimes it's incredibly competitive to get a place. The entrance test for the public universities in Italy, there's huge numbers of people who take that. It is very, very difficult to get in. But in other countries, it's literally just trying to assess your level. And if you hit the target they're looking for, then they'll probably move forward and make you an offer. So entrance exams, you can find universities that don't have them, but I would say that for medicine, they're nearly always there. For veterinary, less so, but the universities we work with for veterinary medicine don't actually have entrance tests, but most other ones do. So now, when I've told you before, there's 80 odd medical schools and probably about 20 veterinary schools that might be suitable for you. How are you going to work out which is the right one for you? How do you research these options in a little bit more depth than simply knowing that they have a degree that on paper is suitable for you? Well, obviously, one of the things you're going to do is speak to current students on that course, but remember, their experience will not be yours. Often you will find people who've been unhappy or been super happy with their studies, and that's great. It's useful information, but you don't know the background there. So just be a little bit, take anything that people say with a pinch of salt, is basically what I'm saying. Online forums or TikTok or Student Room or Reddit or whatever, I do monitor some of the information that goes up on the Student Room about options abroad. I would say that probably 20% of it is correct. 30% of it is wrong but not harmful to your chances, and about half of it is downright wrong and harmful. So just be very, very careful about the information that you see online. Now, another source of information that you will come across is agents. And I suppose I should say a word about these, because in the UK, often people don't want to work with agents because they assume they're just, getting in the way and directing you towards options that you might not necessarily choose. I mean, I would say that we work as an agent for some universities and not for others. I'm very relaxed about this because I happen to know that the universities I work with are the most attractive choices in Europe, and they're going to get full anyway, with or without you. So I'm not in any position, or I have no interest in trying to push you. But what I would say that in general is that you are probably going through this for the first time in your life, okay? We go through it hundreds of times a year with multiple veterinary schools and multiple medical schools. We do know a thing or two, and we can perhaps help you work out what might be a good fit for you as an individual. Now, when it comes to money, most agents shouldn't be charging you huge upfront fees. There are exceptions there, but when you do come across somebody who is charging you a huge upfront fee, it's probably actually not justifiable. It might be that they are genuinely the only way to get into that particular university. More often than not, it's because they don't have a relationship with that university and they're just trying to make sure they get paid. Okay, so you can shop around for agents, go with somebody you feel you're comfortable with. But if somebody is asking for you for like 5,000-6,000 euros before they even answer any of your questions, then no, you can move on and find other people. Some countries these days, I would say, agents are not necessary at all. That would be the case in Bulgaria. We're often asked why we don't work with Bulgaria. It's partly because there's no need. They won't work with agents there. And it's partly because there are so many cowboys out there working with these universities that I just don't want a part of it. So, agents have a place, but it's, I would always say, contact us, but then decide what you want to do. We will give you information. And if you go on to choose to follow one of our options, fantastic. If you choose to follow somebody else's, also fantastic. Good luck. So now how should you, after you've researched your options and looked at all the information that you can find, what would a sensible application strategy look like? Well, I would say that you need to consider more than one place. I would suggest that, if we are talking about plan B here, probably talk about plan C as well. And I mean, I hate just talking about it as a plan B because it gets into people's head that these options abroad are inferior to the ones you're working with in the UK. That is absolutely not the case. In some cases, they are better than British medical schools, but I do understand if they are your second option for financial reasons, and also, there are complications involved in going abroad. But it's not simple to go abroad. These universities are not simply waiting for you to show up and say, hang on, here's my money, I want a place. It doesn't work like that. It's still competitive to get in abroad. Now, our advice on this about when you apply is a little bit different, perhaps varies a lot from university to university, but we actually encourage people to go through the UK system, see what they get, and then the moment they know it's not going to work out, that's when you push the button on an application abroad. Okay. There's not necessarily a need to do it any earlier. We will tell you if you're about to miss out because of deadlines or courses getting full. One or two of the options, the entrance exam is very early in the year, say about February, March. So you might have to do it before you've heard back from your British choices. But ordinarily, you can go through the process in the UK and then decide to apply abroad. But please do your homework now. I am sure your schools are telling you when you come back in September, you need to know which 4 dental medical schools you're going to apply for, or which 4 vet schools. You should have 1 or 2 abroad that you've also looked at. You think, right, well, if I need them, I can go this way. The other thing you need to bear in mind when you do apply to universities abroad is that if you receive an offer, you're probably only going to receive it for a few weeks, something like that. Maybe some places it's literally only 48 hours. And you will need to reserve that by paying a deposit. And these deposits are often not refundable. So you might be risking thousands of euros if you're not convinced that you want to go ahead. So again, we tend to tell people to apply when they're ready, but I do appreciate that's a little bit difficult. I have rather covered the last point already about application deadlines and test dates. These are things that you need to know when you're doing your research. Put them on a timeline so that you know which university when. Whenever we're working with candidates or applicants, whenever we're given enough time, we advise people this is when you'll have to make a decision about this university, this is when you have to make a decision about that one, and this will be your first choice, this will be your second choice, and so on. So there are strategies for dealing with multiple applications, but doing one, seeing how it goes, having it not work out, start on the next one, it's not a wise thing to do. Let's put it that way. So talking about this and talking about when you might miss options or entrance exams abroad, when do international medical schools get full? Well, I would say that the ones in Italy, you've already missed the entrance exam by quite some distance for this year. Those typically happen around January through March. So you would need to apply before March. Okay. The Central European options, the German ones and Cypriot ones that we work with, yeah, I would say they might already be full by now, but they're not full earlier in the year. So you might still be able to apply for a little while yet. The public medical schools in Italy that I mentioned, it's too early to say anything about them for 2024 admissions because the exam won't even happen until September this year, and then you'll start October this year. So it really, really is very last minute. So if you're thinking about that as your number one backup plan, yeah, you can do the exam after you've taken your A-levels, after you've gotten your results next year. Although I would say the deadline for applying for the exam is before results day. So you do need to keep an eye on that. That's what I'm talking about with your strategies. Make sure you know everything when you're going to have to make a decision on which particular school. So you've probably already gotten a bit of a sense of this, but I suppose I should make it explicit. How does this fit in with UCAS and UK applications? Well, the short answer is it doesn't. There is no crossover between the two. You're going to find it's messy because decisions are made at different times and deadlines are all over the place. So what I would suggest you do, 15th of October, obviously, is your UK application deadline. If you get rejections in December, January, no problem, we can easily help you, okay? If you get interviews and you get rejections after them, you should know by late March. In previous years, you would have known by late March, but that can now push on through into May and July. British medical schools have often kept people, or are now keeping people hanging on for decisions longer than they ever used to. During that time, your options abroad will decrease. Okay. If you get offers, but you missed the grades on results day. So say you get to August 2025 and you don't get the grades and you're thinking, oh gosh, what am I going to do? I don't really want a gap year. I will probably be saying to you, well, if you haven't thought about this, please take a gap year because this is a huge decision to take right now. But you can always contact us and we might be able to get you into Central Europe or possibly Cyprus, but it really does depend on what happens. If a university has a lot of British students, it's quite possible that some of their candidates don't make the grades required as well. So there might be a little bit of fluidity around that time. But certainly don't plan for that. You can talk to us on that day, and if we can do anything, we will be happy to do it. Although do bear in mind that post-Brexit, with the requirement to get visas and everything, it's going to be a bumpy ride, but it can be done. Okay. Now, another couple of questions that come up very, very frequently that I just want to address in a little bit more detail. Recognition of EU qualifications post-Brexit. I don't want to get into recognition of non-EU qualifications. As you will know, I'm talking only about European Union options today. There are other options outside the European Union, most notably in places like Georgia. We don't really have anything to do with those, and there can be recognition issues with those qualifications. So my first piece of advice to you would be stick within the European Union, because no matter what happens, you've got a qualification that's valid in 27 countries. This year, for medicine, is the first year that everybody in the UK is having to take what's called the UK Medical Licensing Assessment, which you probably, I hope, have heard from. And this actually creates a level playing field for graduates abroad and in the UK. Everybody has to take this test, whether they graduated in the UK or abroad. There is a bit of a peculiarity at the moment that anybody who graduates from an EU medical school is exempt from the UK MLA as things stand. But that is a weird quirk of the way Brexit has been done, and it will probably disappear at some point in the very near future. For veterinary medicine, the situation is a little bit clearer because the Royal College of Veterinary Surgeons came out very early in the whole Brexit aftermath and just said that, look, if your degree is recognised by EAEVE, which is the European Association of European Association of Educational I can't remember it exactly, but it's about veterinary education. Sorry, I've just had a complete blank on that. But EAEVE qualifications can be, if it's recognized by the EAEVE, then you're fine. You're welcome to email us and we can send you the up-to-date list of who's got this accreditation. They do go through it. It's every June, every year they publish a new list. So there's probably a brand new one that I haven't even seen right now. But what about other routes into medicine abroad that don't involve going to medical school in the UK immediately? Well, some of you might be offered foundation years in the UK, pathways into medicine. I should say, before I get talking about all of these routes, that I have a very, very negative perspective on your chances of success from all of them. But that's largely because of who I am and who contacts me. Every year we'll get hundreds of people who contact us because they were trying one of these things and it didn't work out for them. The people who tried these things and it did work out for them, I never hear from. So my perspective might be a little bit skewed on this, but I would say that students who are offered foundation years with progression into medicine, quite a few don't get it, okay? A lot of people think, well, I'll do biomed science and then apply for graduate entry in the UK. Fair enough, it takes 7 years rather than 5 to get to the point where you're qualified, and you can get your student loans all the way through. But it's even more competitive. I've been looking at the numbers today. Your chances of getting into grad entry are even lower than getting into undergrad entry, I would say. So you might be pushing a no further down the line. And more often than not, none of the studies that you take or from biomed, or none of the classes you do in biomed science can transfer into a medicine degree. I'd be very, very skeptical of any agent or anybody who offers you this. This is where problems with recognition are very, very common indeed. When you put biomed science credit degrees or biomed science degree credits into a medicine or a veterinary degree, that can cause you some serious recognition problems at a later date. So I'd be very, very careful about that. Because graduate entry in Europe doesn't exist. 2 exceptions to that. One is Ireland. The other one is, well, you're going to hear from them in a moment, the University of Nicosia. But generally speaking, there is no such thing as graduate entry medicine in Europe. If somebody offers that to you, what it means is they're going to give you accelerated admission into the 2nd or 3rd year of an undergraduate program, which will get you a degree, but could cause you a recognition issue later on. The only way you can move credit from one degree to another justifiably within Europe, I would say, is if you're moving from a medicine degree to a medicine degree or a veterinary to a veterinary, that is possible, but you will usually lose time and money if you do that. So if you completed 3 years at one place, you probably might get 1 year recognized at another. You certainly won't get 3 years recognized. It's just because of the way different degrees are structured. So don't rely on that. I would always say as well, and this is something we get quite commonly, particularly later in the cycle, when we get people who've seen that the attractive options have gone, they're like, oh, but if I start somewhere else, could I move to a more attractive medical school later on? The answer to that is, well, don't bank on it. Okay. I wouldn't say that's likely. We also get students sometimes who say, well, if I start abroad, could I transfer back into the UK in second or third year, as some people will drop out and there might be places free. That doesn't happen in the UK. It does happen in places like Germany and France. So you will probably sit in a medical school abroad with classmates who have that as an option, but you probably don't if you're thinking about the UK. I never hear about this happening, to be honest. So I would almost always say that if it doesn't work out for you in the UK first time round, it's almost better to cut your losses and go abroad immediately. But I do understand that for financial reasons, for personal reasons, you might want to try other options before you embark on this journey. But I'm now going to just very quickly bring up some of the options that we work with. Veterinary medicine, University of Nicosia, who you're about to hear about, University of Zagreb. Both of these still have a few places remaining, I believe, for 2024. Medicine, we work with, well, 5 universities, as you can see there. For this particular year, Università Cattolica del Sacro Cuore has long been full of both its Bolzano and its Rome campuses. The other options there, starting to get full, I would say, but you do have possibilities there. Now, I'm going to stop sharing my screen right now because I want to enable Dr. Soulla Nicolaou to she's going to become the host of this meeting now, and she will share her screen, and then you will learn a lot more about the University of Nicosia. So hopefully, Soulla, that's now possible for you to do.
Thank you, Mark. Actually, I think you gave the right to Christos rather than me. So I'm not able to.
Sorry,
Yeah.
I did. He jumped in above you. So
okay.
Let me just see how I'm going to do this. Okay, I have to reclaim host first, and then make you the host. Sorry about that, everybody, but I think it's now worked.
Yes, thank you. Okay. Let me get this out of the way. Okay. Thank you, Mark, and good afternoon, everybody. I'm going to tell you a little bit about our medical program at the University of Nicosia. I am an associate professor in pharmacology, the MD program director, and associate dean for students. So first of all, I'd like to tell you a little bit about the university. And then I'll take the majority of the time to tell you about our medical school and the MD program. So the University of Nicosia is the largest university in Southern Europe that teaches primarily in English. We have quite a multicultural environment with students coming to us from all over the world. We offer over 100 degrees in all levels of tertiary education, and we were, in fact, the first to offer a medical program in Cyprus back in 2011 in collaboration with St. George's University of London. We offer our curricula in our 20 building modern urban university campus. As you can see in this aerial view here, in the area of Engomi in Nicosia, which has become a well-developed area for students as the campus has expanded. So we're very proud of the University of Nicosia rankings. We have been ranked by the World University Rankings in the top 2% universities in the world, #1 in Cyprus and Greece. And you can see here that we're among the top 501 to 600 universities in the world, and 155 amongst the first 155 universities in the European Union. We have also been awarded 5 QS stars for overall excellence in distance learning education. And I also wanted to highlight that Nicosia is the #1 small European city of the future for human capital and lifestyle, ahead of cities like Oxford, Geneva, and Basel. The University of Nicosia Medical School, since its establishment in 2011, has been very successful in graduating our students and making sure that our graduates are securing traineeships and residencies and research opportunities in some of the best medical centers around the world. We're also listed in the World Directory of Medical Schools. So speaking of graduates, I wanted to share with you some of the achievements of RMD graduates. So the 6-year program offered at the University of Nicosia started its operation in 2014. So that means we had our first graduates in 2020. And this is where our graduates so far have ended up. You can see that about half of our graduates have been successful in registering with the GMC in the UK and securing positions in foundation programs. And that, of course, exemplifies the fact that our degree is recognized in the UK, and we're working very closely with the GMC post-Brexit to ensure that our graduates continue to be employed in the UK. And this includes not only graduates that originally are from the UK, but also our other graduates that come from all over the world as well. So you can see also an indication of the extent of where our graduates end up, which again shows that our degree is widely recognized in the world. So in addition to the 6-year Doctor of Medicine degree, which is open for high school leavers, we also offer the Doctor of Medicine graduate entry degree. This is 5 years long, but it's for students who already have a university degree. The program offered in collaboration with St. George's that I mentioned already, that we started with, is now in the teach out phase, because we have introduced our own graduate entry program. We are also offering online master programs, and we also offer a PhD in medical sciences. The University of Nicosia also offers a Doctor of Veterinary Medicine degree, and this is for high school graduates. So our curricula at the University of Nicosia Medical School are delivered by a dedicated team of 87 faculty members, and we collaborate with over 700 colleagues, and this number reflects the clinical training opportunities that are available to students and our collaborations with physicians who are training our students in the clinical environment. Our faculty is supported by a dedicated team of 78 colleagues. So following this short introduction about the university and the medical school, I'd like to tell you more about our 6-year program, which is awarded by the University of Nicosia Medical School. It is at the level of undergraduate degree. At the point of graduation, our graduates would have accumulated 360 ECTS credits. The language of instruction is English. And as I mentioned, we started operation in 2014. This is an accredited program. We have been accredited by the Cyprus Quality Assurance Agency. It's important to note that we have been assessed against the World Federation of Medical Education Standards, and this is what gives our degree this wide recognizability across the world. We also meet the requirements for mutual recognition in other EU countries. We are specifically listed on the EU Annex, which means that our graduates can take their degree and they can practice medicine in any European country provided, of course, that they meet any other requirements, for example, language. And I already mentioned that our degree is recognized by the GMC, and a number of our graduates are already in the UK. So in terms of our admission criteria, similar to what Mark was saying, we do require 3 A levels. It's one of the options. One of them has to be in biology. The other one can be one other science. It can be chemistry, physics, or math, so 2 of these. But we do recognize that our students come from all over the world, and they could have completed other educational backgrounds. So we do accept IMB, we accept high school leaving certificates, and if you have any other qualifications, our admissions team can advise as to the requirements. We do have an English language qualification requirement because it is a program delivered in the English language. However, we don't require this from native speakers. This is waived. And a personal interview conducted online is the third and last part of our admissions process. So to tell you a little bit about our curriculum, we have 3 years of the preclinical curriculum. Year 4 is an integrated year. It's an important transition year that bridges the gap between the preclinical years and the clinical years, and introduces students in the clinical environment and gives them a flavor of what they're going to be doing in their clinical years. Upon completion, students get their Doctor of Medicine degree. So this model encourages spiral learning. Holistic medicine, we do emphasize the basic and biomedical sciences, but we also give our graduates a strong foundation in behavioral and social sciences, ethics and law, and evidence-based medicine. We do believe that clinical training early on is important for a vocational profession such as medicine. So in delivering the curriculum, we very much believe in student-centered learning, and we incorporate that in all of our teaching. So we do have large group teaching, which is quite interactive, and we have small group teaching to teach clinical and communication skills, labs and practicals, flipped classroom. We also have a lot of individual and group work, and we try to pass on to our students that teamwork is a very important skill that they need to start developing before they graduate medical school. Clinical placements, of course, is the main pedagogical approach in the clinical years, and self-directed learning is an important skill. So we do have a primarily discipline-based curriculum. However, we have incorporated quite a bit of innovation in the curriculum, including, for example, ultrasound, virtual patients, the way we teach cultural competence, and the way we teach communication skills. We deliver our curricula in our state-of-the-art infrastructure. We're very well equipped to deliver the curricula. We're the only medical school on the island that uses cadaveric material for anatomy. We have simulated wards for clinical skills, and everything that would be required to run the program. We also have student residences on campus, which is very convenient for our international students, which is within walking distance from the medical school and the main campus. Now, in terms of the clinical training facilities, we do have our own medical center at the University of Nicosia. It operates under the national healthcare system, and it does serve the healthcare needs of the community. So that means that our students actually have on campus healthcare services, and we also use the medical center for the training of our medical students, primarily in year 4. For years 5 and 6, we have established collaborations pretty much with all the major service providers, clinical service providers in Cyprus, to deliver our curriculum in all the specialties of medicine. And these are some of the hospitals that we use throughout the curriculum. For years 5 and 6, which are the predominantly clinical years, our main teaching hospitals are in Cyprus. We utilize Limassol General Hospital and Paphos General General Hospital. Now, you're not required to learn Greek. However, it is very strongly encouraged that our students learn Greek because it's going to improve their learning experience and allow communication with the patients. To this end, we do offer free Greek classes. However, we do recognize that we have a very international student body, and we offer international training opportunities as well. You would be particularly interested in our UK clinical site, which is in Lewisham and Greenwich, and NHS Trust in London. But we do offer opportunities also in Switzerland, Greece, and the United States. There are some limitations for students joining our international training sites. For example, the UK site, because of Brexit, does not accept any students other than UK or Irish citizens. And there is a clinical training supplement fee for the clinical sites that are listed here. We work very closely with our clinical sites. Every year we discuss the clinical capacity, and the number of students in each site is based on this. If there are more students that are interested than we have positions available, then we go into random allocation. Just very briefly, I wanted to highlight that one of the things that we are passionate about, and I think we do very well, is student support here. All our students have a personal tutor. The career outcomes I showed you are partly due to the support they get from our careers office. We have occupational health services and counseling services. The Associate Dean for Students that I'm now in the position of oversees the student learning experience. We have high quality health services at the medical center. We have financial assistance, and our student services and registry are there to support students with any questions they may have. So besides the rich curricular opportunities we have, there are other opportunities also for students to get involved outside of the curriculum. We have the Medical School Student Society. We run very successful clubs and societies. Our Student Services Center also organizes activities for students. We have a strong community outreach program. You can see here our mobile clinic that travels around Cyprus and provides things like diagnostic services and so on. And to encourage students to participate, we have a student award scheme that can be used for students' enrichment of their CVs to maximize their opportunities for foundation training positions. In terms of our tuition and living cost, for the preclinical years, it's 18,000 euros, 22,000 for the clinical years, and I mentioned already that there is an additional fee for some of the international clinical sites. The scholarships are based on the financial situation of the sponsor, so they're not based on academic considerations. The cost of living in Cyprus is quite reasonable, between 9,000 to 12,000 per year, depending on the lifestyle of the student. Our students also enjoy quality of life in Cyprus. It is the sunniest country in Europe. We enjoy over 300 days of sunshine per year, even though it is quite hot now. Getting around is quite easy. 80% of the population speaks English. The cost of living is affordable. And as I mentioned, Nicosia is ranked as the #1 small city in Europe for lifestyle and education. So we would be very happy to receive your application. You can submit it online at the link here. We have a rolling admissions process, and we are inviting students to interviews based on predicted or actual grades. So we stop admitting students when we reach our targets for the years. You can contact admissions if you have any questions. Our preferred mode of communication is through email, but we do have a UK toll-free number, and you can also visit our website to read more about our medical school and our programs. So in summary, the MD program offers a strong background in basic clinical and social sciences. We utilize multiple student-centered teaching methodologies. We do utilize high-quality assessment as well in a student-centered program. We provide our students with clinical training opportunities, and this supports them in pursuing their careers in their chosen field of medicine in the country of their choice. Thank you very much for your attention, and I will be happy to answer any questions you may have.